Matthew Bonds. I'm the CEO and co-founder of Pivot.
And I'm Meg McCarty. I'm the Assistant Program Manager of Pivot.
Pivot's primary mission is to provide comprehensive and accessible healthcare services with rigorous scientific research to break cycles of poverty and disease. In a nutshell, it's to create universal access to healthcare for the poor.
Specifically, we work in a rural district in Madagascar, near the Ranamafana National Park.
Rural Malagasy do not have access to primary care, and so they die due to reasons that are treatable and preventable. For the last few years, the health system has been largely a place where people go to die. So the main goal is to implement what the Ministry of Health wants to do if it had the resources to do it. So what that means is that most health centers in the district where we work, a district of about 180,000 people, most health centers should have a medical doctor. So our job is to help them get a medical doctor. Most of them should have a nurse and midwife. Our job is to provide that. Most of them should have a pharmacist or dispenser, and our job is to support that. They all need training. Our job is to help them get training. They need drugs and supplies, so we provide the resources so that they can order their drugs and supplies. We provide oversight for that. We support an ambulance network. We do infrastructure improvements. All of it to make the system function as it should, as it really can, and as it does in some other countries, like in Rwanda.
Yeah, and our general philosophy is health system strengthening, and that means all of the things that Matt mentioned, whether it's financing, personnel, products and supplies. The idea is that no health system could function if any one of those things were missing. And so our goal is really within our district, our particular catchment, to provide all of those things all at once, to give the Ministry of Health a clear picture of what a cohesive health system, functioning health system would look like.
The most important thing that I think is that, that I really appreciate as when we get counsel from one of our board members, Paul Farmer. He says, be the house of yes, don't be a slave to your model. If someone's dying from something that's not in your model's wrong, that person's not wrong, and don't buy your own PR, So of course we have a statement, we have a model, and we have goals, and we need to sort of describe things in understandable ways to the public and to the government. But our job is to help people get access to healthcare, and so do whatever it takes. In terms of the mission that we're doing, I'm most proud of the fact that we have essential drugs in the health center. So our first initial area we're working is an area of about 65,000 people. There are 4 health centers. A year ago, it's this very small, highly inexpensive diseases to treat would kill people. 1 out of 6 kids were dying before they turned 5. Now, the entire population can access 45 drugs, the vast majority of problems they might face, and access to over 20 kinds of consumable supplies for free.
I guess I'm really proud of the staff that we've put together on the ground, that we have a really strong teamwork between our expatriate staff and our local Malagasy staff who have come together to join this team. And I'm really also want to give a shout out to Next Mile Project. I'm really proud of the partnerships we've built here in Boston and the other organizations that we're able to work with and learn from.